Hey, Gainz Nation, welcome back to another podcast. This is actually pretty awesome because it's been nice. I haven't actually been downtown Chicago probably in a year. I haven't been down back since last November, and it is now June, so it's already been 7 months, and it's also nice to get this content out to you guys because we also have a very special guest. And it's been really nice to do something in person because, we've been doing something over virtual, and our guest today wanted to do something in person. And I was like, man, this is nice because it pushed me to come out here and show up. I feel like I got the Lex Friedman or Andrew Huberman look going on right now because I didn't want to show up in a stringer because I don't know if you've seen any of my workout videos, but I like the old school bodybuilding look, and for my brother, he also likes wearing those tank tops, shorts, and also the people listening that follow my social media page, they're probably like, wow, this is the most clothes I've ever seen Antoine wear. So without further ado, I'm gonna let my guest introduce himself, and I'm keeping the name because I want him to introduce himself, and then we'll kind of kick it off there. So go ahead, buddy.
All right. Well, I'm really happy to be here. Actually, we're in my clinic now, but happy to be with Antoine to talk about this. So my name's Tyler Saunders, and I'm a doctor of osteopathic medicine. So, some of the things that we had talked even pre-recording about were kind of what it is I do, and how I value the relationship between health and ultimately the things that we do on a day-to-day basis. So a little bit of background on me. I'm trained as an osteopathic physician, which is something that we're going to talk about a little bit more in detail because I think some people are aware of the distinction MD versus DO, but we'll get into that. In addition to that, I'm trained in internal medicine, which is more adult specialty. As an osteopath, I do manipulation, but in addition to that, I'm certified through the Institute of Functional Medicine to do functional medicine. All right, so I think right off the get-go, we kind of talk about what some of those things are. I think a lot of people have an understanding of what they are, but overall, what does that really mean? How am I different as a provider than kind of the normal doctor that you would go see? So go ahead. Yeah,
what I was going to say is we've been trying to push this down, you guys, and this is 4 years in running, and we want to get someone like Dr. Saunders over here to get on board and to bring information to you guys. And I think this is perfect because this is why we started the podcast. We wanted great information from specialists to help people out. I think the people listening, they're either starting out on their fitness journey, they're either unhealthy, or they're healthy, they need a direction, or they're unhealthy and need a direction. So a lot of the times people kind of come to podcasts, come to this information because, in my opinion, I think a lot of the times it's hard to ask those questions. Mm-hmm. It's hard to come to people like you. It's harder to come to people that are specialized in physical therapy or performance or, whatever the specialty might be. And I think that's why we started this podcast 4 years ago. I know I keep saying it, but I think this hard work kind of led this here, and I can't wait to hear about it. So before I get into that first question, I'm going to actually throw you a curveball. Mm-hmm. He actually looks like he lifts, guys, in person, and I'm happy to say, I actually want to ask you this because I'm going to throw you a curveball. Mm-hmm. Do you lift, and what do you like lifting right now? What is before we get into the meat and potatoes? What is your style of training, and what's your workout regimen? Because you're busy all the time, and you have a wife, you have a family, all that good stuff. So what is your workout routine before we get into the medical stuff? I got to throw you a curveball.
So I told you right off the get-go, we're not going to get very far. We're going to be going through this whole stuff. Yeah. So the way I frame my exercise is based on 4 basic quadrants. All right, try to simplify it as much as we can. The first piece is the aerobic piece. All right, now a lot of times people refer to this as cardio, which I think is not adequately named because we know there's a lot of different aspects of exercise that help the heart, and that's what we're trying to focus on. So from an aerobic standpoint, I do base a lot of my exercise on zone 2 threshold workouts, which I don't know, some of the people may know, some may not. Yeah. It's a whole topic in itself. But the idea behind that is to focus on how can we raise the heart rate or raise the lactate levels to a certain point before we get into really using a lot of lactic acid. Yep. Now, the key in that is purely based on optimization of mitochondrial function, which are the center powerhouses of how we produce energy. Yep. So for me, the aerobic piece, I spend about 3 to 4 hours in zone 2 as much as I can. I can do it running.
3 to 4 hours per week?
Per week, correct. Okay. Yeah. So for me, I can do it running and biking. Running is very hard for most people to do it, but I have a background in competing, running, and those things. So that's to me. So
you and Francois definitely get along really well with that. I was just saying, I don't know if you know this, but I actually just ran my first marathon in January.
Oh, cool.
Yes, I did 5.5 hours.
Gotcha.
I don't know if that's good in your eyes.
I've never done a marathon myself, and I never will because I will hurt myself.
Are you more short distance?
Yeah.
Okay.
So I competed in college, post-collegiate also.
Okay,
800 meters a mile.
Is that track and field then?
Yeah. Mm-hmm.
Okay.
Yeah. So
awesome. Francis did cross country and track, I believe.
Correct.
In high school, yes.
Yeah. So I ran mile 800 mostly.
Okay.
Competed at nationals in college and a mile as well. So
what's your fastest mile?
So I'm post-collegiate, I ran like 4:15.
Holy cow. But I think mine was probably like the just before 7 minutes. Like that is insane. Good on you. And like I said, I'm not really a runner. I'm more of a lifter, but I know how like hard that is. Sure. So that's really good. Awesome.
So now obviously for most of my life, most of my career, the cardio, the aerobic piece was kind of the most important piece, because when we're talking about cross country track and things, we're talking about keeping lean, not having too much muscle mass because the weight was a potential problem, right? To speed. So in my exercise program, we have the aerobic piece, and we have a more anaerobic piece, or more like high intensity piece. Yeah. I don't spend a ton of time there because I don't necessarily think it's necessary, but this is all VO2 max stuff and is focused on as much as we can. Zone 5, Zone 6, you've probably heard those types of thresholds. It's kind of where we're focusing. I don't spend a ton of time there, 15 to 30 minutes at most. 30 minutes would be pretty intense for that. I can do a lot of it running pretty well. I mean, the other day I just went out to the track and did a 5-minute mile. You just got to remember that I still can, that kind of thing.
So that 5-minute mile is like a zone 5, zone 6.
I mean, it's probably pretty close. Not zone 6. I mean, zone 6 would be all out, but zone 5 it's a pretty good effort. I mean, my heart rate's 180s-ish, 190s, probably close to that.
Okay.
Could I have done another mile at that pace? Absolutely not right now, but so that's, I make sure I hit a fair amount of just. From a VO2 max standpoint, if I can optimize my VO2 max to even someone 10 years younger than me, that to me would be ideal. So that for that piece. The second piece would be the resistance training piece. Now, this to me is developing. It's been developing a lot over the years. I've tried to make it very simple. I've tried to make it, how can I optimize for as many muscle groups as I can, compound lifts and focus on that. I have a basic push-pull and hinge kind of mentality for how I want to approach those things, right? So that I know that if I can do, a chest press, some type of row or pull down, and a deadlift, an RDL of some kind, like I can get the majority of the muscles in my body. And from an efficiency standpoint, that's where I spend a lot of my time, right? So for doing that right now, I've been really kind of obsessed with the last component, which is how can I improve stability? How can I improve the movements that I'm making? Mm-hmm. And people probably talked about functional movements and the importance of that. How can I make those, that effective so that when I am doing RDLs, I've been using a hex bar mostly because I've had back issues in the past. When I'm doing those, how can I then, focus on improving the muscle mass and the hypertrophy and maintaining the power, which is something that we do lose if we don't use it, without, worrying about injury. And I've injured myself so many times, so many different levels, that kind of my obsession is in that last category, which is like, how can I continue to create stability and focus? So a lot of what I've been doing in that regard is foundation training. I'm doing a lot of focus on isometric hip hinges to kind of improve that, mostly improving the strength of my feet all the way up and through my glutes and my posterior chain. So I spent a fair amount of time doing that, and it's just like ever evolving, ever changing. So it's not a short answer. It's like something different every day. Like this morning, I ended up focusing a lot more on my back, and I'm also been doing a lot of isolated grip strength things because, as we know, and we're going to talk about this too. When we're talking about longevity. We're talking about health span as being one of the main goals of why we're even sitting here, why we're even having this conversation. Is grip strength is more closely associated with longevity than almost anything else.
That's pretty cool. Sorry to interrupt, but they probably heard me preach about this all the time. I've done push pull bunch of times, a bunch of years too.
Yeah.
And right now I'm actually doing, I've been doing full body for the whole year.
Sure.
And, I came from competing in 2 bodybuilding shows and then a powerlifting show.
Sure.
And it's so great to see someone like you do stuff like that and talk about, functional fitness, foundational training and grip strength, because, most of my Sundays or most of my some days where I'm doing single hand farmer walks, I'm doing sled pulls, sled pushes, all that. And also you were talking about strengthening like the feet and your foundation. These are some pretty stylish, these are barefoot shoes.
Oh, they are.
Yeah. So, I've been loving those a lot. And I feel like with wearing these and strengthening my foot alone, my feet don't hurt.
Yeah.
My knees don't hurt. My hips don't hurt. My back doesn't hurt. And I think it has to deal with, like you were saying, being strong in your foot, being strong, through the whole foundation.
Sure. Yeah.
So I love it. Like someone like him being like, understanding that. And I'm glad that you went into resistance training. Now, back to one more question on that is, when you said you're a collegiate athlete when it came to running, and you wanted to kind of, stay at a lower weight to kind of be at like a competitive level.
I didn't do a good job of that, by the way. I gained a fair amount of weight, all muscle weight. So, but yeah, go ahead.
Yeah. So I mean, back to your saying, like after like your college years, did you find like resistance training more appealing because like you're kind of out of that, like kind of like, like you ran, but like, did you think that resistance training was more important towards you and your health and your youth and, moving forward through the future? Because, a lot of the times people will play like that sport, they'll do that's one sport, and then they'll be like, well, I can't, do that forever. Right. I can't run under 5-minute mile anymore. But where can I go to the future to help me live long, strong, healthy? Sure. So did that kind of shift your focus then after college?
So after college, I was coaching at Johns Hopkins when I did research there. And so I continued to run. And my lifting was like, it was real classic, like college bro lifting. Super special, you know what I mean? So
it was chest day, arm day,
how much
barely legs,
bench, right? And I didn't do a lot of legs because, to be honest, when you're training like we were doing and doing legs, I tried and I would just get cramps, and it was just like it was just the level of intensity that we were doing from a running standpoint was hard, but like lifting wise, like I was just and that's the strongest I ever was, to be honest, was then, even though. It probably wasn't until the last 3 or 4 years where I started to develop a little bit more well-rounded style. I think I went for a couple of years, even during med school, where I was just high intensity, trying to get as much as I can done in the time I have, you know, and that's where the lifting stuff, I think, it's
I think that's also important right now. I mean, getting the stuff you can when you can, because even during that time now, I mean, your time's probably crunched now, and you still need to do what you can, right?
Sure. Yeah, but then it was more like, if I had 30 minutes to run, I'm going to run 6-minute miles for 30 minutes because that's going to optimize the amount of time. But now when I'm thinking about what exactly are we doing there, like I'm not at zone 5, I'm not at zone 2. So like, what am I accomplishing? I'm accomplishing potentially an increased risk for injury without potentially getting the same benefit out of it, right? Whereas now I can sit on my bike in zone 2, listen to a podcast, read a book, and kind of covering 2 at 1, but at the same time decreasing my risk for injury, which is become a little bit more of the obsession overall, because we know what an injury can do. An injury is going to put you out, and you have to stop doing things. And we all know it's much easier to lose than it is to gain. So
yeah, awesome. Well, I'm glad we got into that. I know you're like, man, I'm gonna have to. I just want to make sure they know that you're lifting, you're constantly you're doing your workouts and whatnot, because I think overall, like you were saying, like, risk of injury, you want that to be as low as possible, but you want to stay focused. You want to be able to be healthy. And then moving forward, let's talk about, because of one question I got asked, a bunch of people asked me, because I was telling people before this interview and podcast, I was like, hey, like, what question would you want to ask? And for some reason people kept wanting to ask, they're like, what the heck's a DO? What's a DO? What's an MD? Like, how do we know the difference? So did you want to just talk about that really quickly?
Yeah, and I think this is a question that I have to answer almost on a daily basis, so I kind of got it real
Do you
down.
have like the 30-second elevator pitch?
Right. So the basics of it is that there's two types of medical schools in the United States in terms of degrees that you can be medically licensed as a doctor, right? So there's allopathic medical schools, or MD, and then osteopathic, or DO. Mm-hmm. And the truth of it is that when you go really far back into like the early 1900s, when these things were kind of starting, is there were a lot of different forms of medicine. These were kind of two of the only ones that stuck in terms of the medical licensure. Now there are other forms of doctors and other forms of healers and things of that nature, but it's different than the medical doctor, which is osteopaths and MDs. Now we've been kind of slowly merging on this collision course to the point of there's people that say, well, we should just all be part of one. And at this point, residency training program is almost identical. The matching process in which you get assigned to where you will be training is the same process. It used to have two separate matches. Yeah. Now it's all into one. So generally, when it comes to training, this is kind of the important part of the medical education. Yeah. And the first 4 years in your allopathic or osteopathic school, there's differences. And then once you kind of join together to merge, there isn't a ton of differences over time. And I do think that the osteopathic philosophy is a more holistic approach. Yeah. I do think in some osteopathic schools that is kind of, they talk about that in more detail, and other ones they do not. I think it's a very important part of osteopathy, but it doesn't always carry around to all osteopaths. The biggest difference between the two is we're trained in manipulation. Yeah. A lot of people know what chiropractic manipulation is, but we're trained in osteopathic manipulation, which generally, if I were to do it on you right here and a chiropractor did it next to you, you would be like, those look the same, right? They look very similar. There's a lot of similarities, I don't know how chiropractors are trained, so I can't give you a general idea of what the differences are in that regard. But when it comes to manipulation, talks about body work, we have chiropractors do the majority in the United States. Osteopaths don't do very much because a lot of them don't go that direction. It is a part of my practice. I do a little bit of, not a lot. And then there's napropaths, there's massage therapists. A lot of PTs are getting into manipulation and things of that nature. So the short story is that MDs and DOs, ultimately, there isn't a huge difference. Yeah. The training is now almost the same. We are trained in manipulation, although only about 5% of osteopaths continue manipulation on in practice after their training, which, at that point kind of differentiates a little bit. Yeah. I do think osteopaths are more likely to be primary care providers than MDs are. And that may have a lot to do with kind of the process of getting into the schooling and people's interest. If you're taking a more holistic approach, it makes more sense not to be focused in on one specific issue, right? So that's kind of the short of the long of it. That's kind of the idea. You kind of get the idea that, to me, it's not a ton different. My philosophy and the way I practice medicine is more osteopathic, more holistic in nature, but that's more of a nature of other things that I've done and how I kind of ended up in this position as opposed to what happened during medical school.
Yeah, so two things from that. I like what you said, like the holistic approach, because what you're going to get into, I know you're going to get into some of that right now, but like I think that's like something that with health and fitness is such a big thing, is because like, when you're like your hip hurts or like, hey, you're moving wrong, so like something hurts, you don't look at it as like a one approach. Like you don't say like, hey, I twisted my ankles, I'm not going to do anything, I'm not going to walk. I don't know what happened, but I'm just not going to walk until it doesn't hurt. Mm-hmm. In an actual real approach, you want to look at everything. You want to look at like what happened here. Why was I walking wrong in the first place? What was wrong with that movement? What can I do in the future to improve that? And what I've learned is getting into like the health and fitness industry is you can kind of see that on a daily basis within people. Mm-hmm. I don't get to see it as much because I don't work downtown anymore, but like, the amount of people you see just over in this area is like quite a bit more people when I see in the suburbs. Sure. So I like that idea. But the second question is, and you don't have to get into it much, is like, do you ever think like the MD and DO path will combine, or because the philosophies are so like are not so different but different, Like, do you think they're just going to just stay like that, even though it's like kind of the same you were saying, but different approaches, I guess?
Yeah, I don't see that happening anytime soon. A lot of the old osteopaths obviously are holding out, and the foundation of what goes into creating a school in order to do that, I don't think it really makes sense. I do think that, as we continue to promote the osteopathic philosophy, it's one of the largest growing, sectors of the medical community, and I think it's something it's a good thing. I think having different physicians with different potential approaches is only a benefit to patients, especially ones with symptoms that we're not able to do anything about. All right.
Yeah.
So right off the get-go here, 50% of patients have at least one symptom that we cannot explain medically. All right. Yeah. So when we're talking about coming in from a different perspective, you've interviewed, you've talked to physical therapists, chiropractors, you talked to all these different people. Having a different perspective, coming in and saying, I'm looking at it from more of a musculoskeletal standpoint, because in order for me to pass the boards I have to for osteopathy, they lean into that a lot more than the MDs do. So I think that I don't see them merging, but I definitely think that, there's a lot more similarities than people know. But I do think that when you're looking for a physician, because that's ultimately the question, people are like, should I be looking for an osteopath? I honestly think it has a lot to do more with the individual than it does with that aspect of the training, because there's so much that goes into the training outside of that I would kind of focus on that more so, and that's an individual's approach to how they treat patients, whether it be holistic or not as holistic. Unfortunately, holistic is kind of a garbage term. It doesn't really mean a lot.
It's one of those hot terms where it's you have to say it, but it does make sense though if you, I guess, define it. Yeah. Coming in real quickly, I know, like I said, the questions and ideas that pop up when you talk. Yeah. And this is what you were saying is all great. I think the people, I guess, I feel like with it being 2023, the approach is a little bit different. And something like this to talk about things and also get your ideology out there to the people, I think it's so great, because the fact is the real world is this. I mean, so, and this is like an example that just happened to me is my dentist just retired. And it's like, okay, well, my wife's family been going to him for like 20 years. Really great guy, really does a great job. He's been in the industry for a long time, and he's a very smart guy. So now, since he retired, what do we have to do? Find a new dentist, right?
Sure. Yeah.
So what this is an example for me. I'm on Blue Cross Blue Shield website, and as many of you guys might or might not have that insurance, it's like you go on there, and it's kind of like a Yelp review. And it's like, it's like a Yelp review for doctors, right? Mm-hmm. And so you go one by one, read the reviews. And it's also, if you know what people are like, when you read reviews, it could have been like they were having a bad day. For some reason, the doctor tried providing as much information and tried to help them as much as possible. But at the end of the day, if someone's not happy, they're not happy. So what do? We're keyboard warriors. Like, hey, Dr. Saunders did this. So I think this is like a great way to kind of, back to the original point, to get your ideology out there, because if more doctors had like platforms, more communication with patients, like outside of your typical practice day, then I think we would see the medical industry grow so much. And I know a lot of the time, like people like you don't have the time. And I think it's great to, have someone like this podcast to kind of bring it out. And, I know you said that you're going to try to work on your like social game and how to bring your ideas to up to par with like to getting out there in public. But I think this is a great way. I honestly, like I said, I don't like going to like Blue Cross Blue Shield to find something. It's like, it's like going to a restaurant or finding like a date, right? It's like, how can you like, you would have to like go there, and then like, a lot of the times people don't have that time. So if you bring your information out there, and if people like you and they're around the area in Illinois, in the north side of Chicago, then like people will go to you. People, if they like you, they want to go to you instead of like looking at a review. and seeing that. So I just want to bring that up because that just happened to me like a week ago.
Yeah.
And it's like, well, what do I do? Do I have to go to like friends and ask them like, hey, where do you go see a dentist?
Yeah.
Hey, do you know Joe Schmo?
Sure.
So it's like, something like this. I think this is also a great opportunity to understand is like, just because, you might be in that situation right now where it's like, you might need to find someone else. You might need to, look at another doctor, whatever the case may be. So I just wanted to throw that out there. But I would like to get back. I mean, we're 25 minutes in, but I would like to get back to like your introduction and like kind of what you do on a day to day, because and they're not a stranger to that. Because see, the thing is with podcasting, the conversations go in different directions, but we still get to that main point. Yeah. So,
but actually want to
go ahead. Go ahead.
Jump in because when you're talking about how do you find a practitioner you work well with, I think this is something that we don't talk about. And it's worth talking about because it's a question of if you need to find a new provider, what exactly are you looking for, right? And now I tell my patients on a regular basis, especially the new ones, I ask them, I said, what do you need to know about me? Yeah. Right? No one knows the answer to that question because I was like, wait, did you just ask me what I need to know about him? Right?
Usually you're the one asking questions to them.
Correct.
Right?
So they asked, and then they're kind of confused as they're like, wait, what do I need to know about him? I said, what do you need to know about how I practice? What do you need to know about this type of thing? So there's actually a core group of things that you need to know about a physician before you go into that. And we could probably do a whole podcast on this alone, but at the same time, like that is important. And I tell people on a regular basis that if we're not getting along and we don't create a relationship that's supportive and supports us working towards your specific goals, then you need to find somebody else. And a lot of times people are like, doctor shopping gives this bad name. Like you're not supposed to go around looking for a doctor because they're all the same. Well, that's not true. It's like any other industry. There's good, there's bad, there's in between, right? Yeah. And to me, the key in all of that is that relationship, right? Yeah. And now relationships is one of the 5 main aspects of what we're talking about that are important to health. And your relationship with your physician, your provider, whatever it is just as important, right? Yeah. 50% of people don't take medications as prescribed, all right? So it's probably higher than that. So it's a question of, if I'm giving you a medication, I want to know that you're taking it, right? If you are listening to what I'm saying because you understand and on top of that, you agree and that falls within your goals, the chances of you doing that are much better. Therefore, if I've created a good plan for you, the likelihood of you being able to do it and follow through with it is much higher, right? Yeah. Which is why, for me, the majority of health is in the patient's hand. It's not in my hand. I'm merely a cheerleader in a lot of this, or a coach, however you want to look at it, right? Oh, yeah, kind of walking that makes sense. That, right? Yeah. So you need to kind of be able to break that down. But I wanted to bring that up because we could talk about it. There's 4 main aspects of what you look in for a physician, but we can get into that at a different time if people are interested. Yeah, I was going to say, that's. I'm glad you kind of put a bigger point on that because it does make sense what you're saying. But go ahead. So we're talking about my practice a little bit here. I'm here up at the Clark in Andersonville. What I'm trying to do with my practice is combine the concepts of what we call a more traditional or conventional medicine with functional integrative medicine. Right? So I think that's probably the next space we go into. A lot of people are familiar with the concept of integrative medicine, functional medicine. So I'll define those briefly. Integrative medicine that you think about the person as a whole, all right? You think about how can I change variables in this patient's life to optimize for healing with a focus obviously on prevention and making them feel good in the long run. Now what integrative medicine does very well is it integrates in other forms of medicine, Chinese traditional medicine, Ayurvedic medicine, any form of manipulative therapy and all these other things. How can we use these things to support and integrate together with a more traditional medical model? So it's kind of this East meets West type of thing, right? And we consider a lot of different factors going into that. So integrative medicine is very similar to functional. I'm trained in functional medicine where the idea is very similar in that we're trying to get to the root cause of the problem, right? We use cardiovascular disease as a great example. What is the root cause of cardiovascular disease? Some people will say cholesterol or inflammation or all these other things. And, it's multifactorial. It's a lot of different things. But when push comes to shove, it's lifestyle over and over again, right? We can use lifestyle to prevent and reverse cardiovascular disease. So that's the cause. That's what we're focused on. When we're saying, I want to decrease my risk for cardiovascular disease, how do we go about doing that?
Yeah.
We say, well, we can do that through these lifestyle tools.
Yeah.
And then I do get a lot of pushback from time to time. They say, well, what is the evidence for that? What is to be able to do this? Now, to me, if you're asking that question, then you're just not informed about what is going on. We don't have randomized controlled trials for these things, but we do know that we can reverse disease, we can prevent disease, and it is a crucial factor in what we're doing. Now, are there scenarios where people are doing those lifestyle things well and it still happens? Absolutely, right? Yeah. There's genetic things, there's a lot of different things going on, but when we're talking about functional medicine, the idea and the way that I go through talking with the patient is they fill out a very extensive intake form. I like to know everything. That's what I always tell them. We lay their life out on a timeline, and we say, where did things go wrong? Where do we need to focus?
Real quickly, someone once told me, I'm not going to mention any names, is because that definitely, we'll maybe have him on later on. And he said to me, like, and I just want to break it in because you said, like, you go really in detail on, like, what they did in their timeline. Mm-hmm. And it makes a good point because it's like just because you came in today and for some reason you might have something going on today, that doesn't go to show how many years you put into that, right? Yeah. Or it could have been like, there could have been a multiple things, right? And it's crazy to think that because it's like, it's like, hey, I just moved back from Arizona. I had to find a doctor. Sure. Well, that person's like, well, you make sure you got to tell them this, that, and this. Yeah. Make sure they have all the information because the fact that people like you can listen and understand what people are saying, but you won't know, like I said, I'm 29 years old. You don't know what happened the 28 years. Right. What happened before me? What is in the family history and whatnot? And yeah, keep going. Sorry.
Yeah, no. So after we kind of gather the original information, that's kind of the initial step. As we work through that, then we have a timeline. I talk to the patients and I tell them their story, right? Yeah. I want you to know when you come out of that appointment that I understand your story and I want you to correct me if I'm wrong, right? Yeah. So that if we're creating a plan based on specific imbalances of what's going on, you have an idea that he listened to me and now he's saying this is what happened and he has a really good understanding of what's happening, right? And then we then transmit that information over to a different, essentially it's kind of a worksheet of sorts, but we break down different imbalances in their life and we say, where do we need to focus our time in order to get improvements to your current concerns? Yeah. And where in that do we do that? And the base of all of that is the things we're going to get into, the 5 aspects of life. It's just all lifestyle. Yeah. And the center of that is the mental, emotional, spiritual side of things, right?
And when I forgot to mention too, is like, when you meant like you said about cardiovascular health and disease, a lot of the times like I love how you keep saying lifestyle, because a lot of the times I don't know if it's because like I've seen like family members, friends, they say like, well, diabetes is in my family, I'm gonna get diabetes, or hey, my dad had a heart attack, I can't do anything to change that. And like, which you probably, and correct me if I'm wrong, you probably believe, but there's still things like you were saying, lifestyle, that can better that chance, right? Because we in this life don't have like 100% chance of getting nothing, right? I could be perfect 7 days a week and still for some reason, my father had a heart aneurysm. I could somehow fall in that category. And I could be 7 days a week. I can count my calories. I can go for a 10-minute walk after every meal. I can go to the gym 5 days a week, and I cannot smoke. I cannot drink, all that stuff that is like basic, like good lifestyle habits, right? And you're going to talk about some of stuff probably in between that. But I feel like that could be the case. And I want to like obviously push like, don't let that be your biggest concern because like what you're saying is that intensive workload, that introduction is going to hopefully push you to give some of those answers, right? Not all of them. You can't give all the answers because it's very hard. We're human. We're not Chat GBT. We're not obviously that has its concern within like answers and people's like believing that. But like I was just trying to do real world example. But yeah, go ahead. Sorry.
Yeah, no. So I mean, the main piece that right when we left off is at the center of how we like to focus on things is the mental emotional side of things. All right, and that's another thing that we're learning how important this is to health with the pandemic and all these things, with the increased level of mental health concerns, and how this is oftentimes a causative factor in a lot of issues. And we could go on and on with a list related to that, but that's an important piece to that. So I think that's kind of the general idea. And from there, we can then work on, say, this person specifically needs to work from a GI tract standpoint. We need to focus specifically on energy production with this person. We need to focus specifically more on hormonal cascade and the communication with those, or structural integrity. We can go through each of the 7 main aspects in that regard and say, those are the things we need to work on in order to achieve the goals that we have to do, right? And as a part of that, intake, I'm understanding your level of readiness to make this change is at a certain level, right? If you were to come to me and say, my dad had a bypass at the age of 55, and I don't want that to happen to me, I can tell you right now with fairly good certainty that a whole food plant-based diet, which is a completely vegan-based diet, is going to be a good option for you because I have evidence to say that it prevents heart disease, right? Yeah. Now, it's hard to argue with that, but then you're going to say, well, I want to make gains. What about my protein, right? So
I was going to say obviously I'm an omnivore, but like it's funny you say that because like even when I competed in the bodybuilding stage, I even saw this guy that blew me under the water, and he was on an all vegan diet, and we also preach that too. Like I just because I'm not a vegan or vegetarian, and like you were saying, like that could be. Like you said, there's stuff that backs it up, and that could be okay as well too. Yeah. And I get what you're saying, but I just say it's all about the gains where it's like I can't hit my daily steak. Yeah,
right. So I mean that question comes to it's all about someone's readiness to change, right? The question I've gotten at a lot of people, more traditional medical people, says, what if the patients don't do what you're recommending, right? And that's a pretty common one because it's a question of, I'm asking you to do something hard, right? If I'm asking you to do a whole food plant-based diet, I don't know if you've tried it before, but it's not easy to do, all right? And I've done it myself. I've done pretty much all of the diet plans I've recommended for people over time because I want to know what it's like.
You want to experience
it, and I want to see what it is. And I want to see how my body reacts to it, you know? When we're talking about those things, we're talking about if you're not ready to change anything, and this is the classic 55 to 65-year-old male that doesn't want to make changes, and this is something I see every day. This is a special interest group for me because if I could figure out how to get them to be a little bit more engaged in their health, the amount of long-term things that we could prevent and avoid is huge. It's huge, And so, the one example is a handful of nuts. I'm not talking about peanuts, but those are legumes. But we're talking about nuts. It's we have evidence to say I can decrease your risk for cardiovascular disease upwards of 30% with a handful of nuts a day. You say your readiness to change right now is super low. Yeah. This is not hard. And most people aren't like, ooh, I don't like nuts, right? Some people have allergies, this and that. But at a very basic level, what's the biggest bang for the buck right now? So the tricky part about what I have to be able to do is to assess and say, your readiness to do this is this. Yeah. If you came to me and we were making an exercise plan and we said, we need to hit these 4 categories, we're not getting enough toe strength. We need to institute toe yoga. We need to institute toe walking and all these other things in order to strengthen the feet up. You'd be like, let's do it, I'm in, right? Someone else, if I was like, hey, you need to start doing toe yoga, and they're like, yeah, I don't even walk, right? It's that's where the piece comes in. It's that's an important part of it. So I think we should transition a little too, right, into kind of talking about these big things. Now, we've talked about a lot of these. A lot of these have come up. When I'm creating a plan for somebody, there's 5 things from a lifestyle standpoint, the modifiable lifestyle things that we can manipulate in order to benefit the patient's overall health. Yeah. And we use those, as I was saying, as the foundation for everything we're doing. If at any point things are not going the way, we need to then reevaluate, right? Yeah. Now, going into this, an important thing is resilience, all right? Your level of resilience, my level of resilience to do something is different, all right? Which means people always come in, they're like 90-10, 80-20, right? You can do a good job 80% of the time and not 20% of the time. That works for some people.
Yeah.
I have people that I see in the clinic that do, like dietary choices 95% of the time, and they continue to gain weight. They continue to have issues related to that. Now, is that a level of resilience? Is that they're having a lot of other issues in the lifestyle things? I don't know, but that level of resilience changes from person to person. All right. So the first thing, in no particular order, I would say I do them because they're written out in a certain way in my sheet. I would say we talk about food. All right. And this is how we actually originally met. I was giving a lecture on food and nutrition and talking about that.
Don't worry, guys. I asked them quite a bit of questions. It was virtual, but I'm pretty sure the person that was in charge of the questions were kind of just like, man, this person in the comment section, he only has this amount of time. But that's what. To get back to like why we wanted to engage and talk is that exactly that conversation. I just love that conversation you had, and it was something that a lot of people would love to learn. But see, the thing is, I think it was like a short audience, or could have been a bigger audience elsewhere. So,
sure.
But yeah, I love it. But go ahead. Sorry.
Yeah. So from a food standpoint, like this is very person dependent. All right. There's a big thing about food that isn't quite the same as the other lifestyle things, in that everyone kind of is an expert in their own self, right?
In a sense of food, or
in a sense of food. Right? They eat food every day, and they believe they have an understanding of this is how my body reacts to food. Real
quickly, do you think that it's because of the fact that, and you probably understand this being around for a while in life, is people saying like, hey, carbs are bad. Hey, fat is good. Vegetables are bad.
Sure.
Meat is bad.
Sure.
Do you think that has to do with it? Because a lot of the times, and there's nothing wrong with it, there's a lot of information out there.
Yep.
And do you think because of those influences, that could be part of the reason why you think people could be food experts? Like because of their own behind the scenes,
right?
And not to knock any names, it's like my mother saying like, "Oh, Dr. Oz said this," and not to, and like I said, I'm not discrediting Dr. Oz.
Sure.
I bet he's a very smart guy, but like something like that, like okay, like my mom heard carbs are bad, so it's like she's now eating nothing but like proteins and fats. Little carbs. She can't even eat a hamburger with buns.
Sure.
So does that kind of like make sense?
I think that's part of the problem with people thinking, I know this. All right. Are you familiar with the Dunning-Kruger effect?
Yes.
Okay. So the concept of the Dunning-Kruger effect for the audience is that there's a pattern of feeling confident in understanding something when you know very little about it, and what ends up happening is, you guys can look this up too. As the more you learn about it, the feeling of confidence actually starts to go down. And we see this phenomenon.
That makes sense, because I feel like, even with like, stuff that I read outside of like fitness, it's like you keep going into it, and then you feel like you still don't know anything about it.
I could sit here and give you a very compelling argument for a ketogenic diet versus a whole food plant-based diet, and say you need to do this one because of this and that. And if you don't carry that background knowledge, you understand, you say, well, he's qualified, he knows what he's talking about, therefore this must be a good thing to do. Yeah. You know what I mean? So when we're talking about that, I think that's a key thing. There's so much confusion in nutrition because we don't have answers, right? And that's the worst part of the whole thing. It's like, is a ketogenic style diet the right thing for you? Yeah. Maybe. Now, do I use a ketogenic diet? Personally, I do not, but I don't respond to it well, and I've done my homework. I've done the lab test to say this is not a good effect for me. Well,
that's what you were saying before that is you said that you've gone through some of these nutritional experiments with yourself. And even with me, my brother Francis got me into lifting at like the age of 16. Sure. Unfortunately, I fell in love with it. And the nutrition side is such a big piece of it. Yeah. And I said unfortunately, but it's fortunate. I just wanted to see. I was going to correct you. Yeah, I was going to see if you're paying attention. But that's what you. That's. Yeah. I mean, I've tried everything. I've tried like ketogenic, low carb, low fat, and I mean, yes, I've had days where I've not like eaten meat. I've done that, but like I said, I think I respond with like a meat diet, and a lot of the times what I preach too, is just like a side note, is like, just because, like you said, someone might say like this is the best thing, it you won't know until you try it. Yeah. And I think like food journaling is like the simplest thing that nobody does, where it's like, hey, I ate a bowl of cereal with like a protein shake.
Sure.
Well, I got my carbs and protein, but no fats. After that, I felt hazy, felt tired.
Sure.
But no one ever does that. I've said it multiple times, like on the podcast, but like something like that has been like such a great thing for me, and understanding like, hey, why does like, eating almonds makes me feel tired, and then like for some reason eating like macadamia nuts or like cashews made you energetic, and you use that fat resource as energy, and that produced really good energy, right? And you had like a good 3 hours, and then you were hungry again, right? So I just wanted to throw that out there real quickly as well.
I mean, I use that tool in my clinic all the time. I do a 7-day food log, and I tell people like, this isn't for me. This is for you to kind of reflect, right? Yeah. Because a lot of times, I mean, from a food standpoint, when people don't have a lot of background and kind of know what they're doing about it, I do have a tendency to focus on protein and fiber as kind of the backbone of where we're at, because there's not really a scenario in which things go wrong in which you do that, as long as you kind of focus on those things. And then we can tailor the diet based on how we think they're going to do with the other macronutrients, the carbs and the fats, and those things are kind of like an initial start point for it, and then we can kind of launch off from there based on what our goals are and what the patient or the person is capable of doing.
One more question before you go transition or to finish this up. Yeah. So let's just say they do the 7-day recording. Yeah. What I always thought it was a good idea, or think it's a good idea, is I always say like, hey, write down these things, write down the macros, the calories, make sure you're getting the micronutrients in, that fiber intake, all that good stuff. But sometimes people can go crazy from doing that, right? And I did the 2 shows, and I've recorded 100% of the time. I've recorded 20% of the time. Sure. Yeah. Also, I've recorded to the point where I think a lot of people can get to, and I just don't think a lot of people want to do that. Sure. Is get to the point where they don't need a food scale. They don't need to always like weigh everything out or look at proportions. Right. Like, do you think that also can lead to successful like nutrition when it comes to like longevity of like health and eating too as well? It
depends on the person, and what in my clinic we're very aware of the concept of orthorexia, and this may or may not have come up to anybody. The idea of orthorexia is that we become so obsessed with what we're eating that it's causing an issue to the point where you are making decisions because you think or that this is going to be bad for you, and therefore now you are avoiding foods. You're not kind of having the joy in food that we all should have. Food is a necessary thing to be a part of this. So, when I go through that, I screen people for eating disorders. Like, we're asking the questions. We're saying, do you feel comfortable writing down what you eat, right? Because the answer to some people is no. Or the other answer is, I've spent 10 years counting calories, and I have not lost weight with that method. And we can come into this and say, well, the calories in, calories out hypothesis for weight loss is ineffective 96+% of the time. I think it's over 99%. So it's a question of, is that an effective strategy? There's a difference between writing down things to have an understanding. And when we talk about things like protein, the number of people that shortchange their protein with the first meal it's tremendous. Right? Yeah. I talked to somebody today who says, well, I have a hard-boiled egg. Like, that's 6 grams of protein, right?
Per one egg, yeah.
Right? Yep. So, like, when we're sitting here talking about this, we're saying, well, if I'm trying to...
For someone who eats 200 grams of protein a day, I can't really optimize my first meal.
For sure.
So right? But that's just an example for me.
You're behind, right? Yeah. And at the same time, like, if you're trying to get the minimum effective dose to optimize protein synthesis, which is what we're trying to do. Yeah. We would ideally like to get the minimum dose. We're talking based on your weight, it's not probably close to 30 grams as a minimum, right? As opposed to 6. But now people are saying, why then, later in the day, am I ravenous? I was like, well, because you've had about 100 calories of food, and your body's like, what's going on? Like, we need to eat, right? So, we could talk about food for a while, but I think generally speaking, the concept around food is very important. We need to be very aware of our relationship with food, and we need to enjoy the relationship with food. So getting back to our roots, meaning eating real food, right? Michael Pollan's quote, eat real food, mostly plants, not too much. Probably a lot of you have heard of it, read the books before. I think it's very fitting. It wraps up the concepts of what we need to be doing without getting too obsessed. All right, there's I think some 1,400 new food products that come out each year. We're talking about not real food, right? Yeah. When we go back to the fundamentals, the basics of what we need to do, and I even think a lot of us right now are overdoing the protein thing, but I don't necessarily think it's a bad thing because we're optimizing for muscle mass, right? Yeah. As opposed to, you can do a lot of things and be very healthy as long as you're eating real food. You're giving the body the signals it needs. Yeah. And it knows what to do with them, right?
Yeah, and one last thing. I know we probably should move on, but like two things is like when I was in like those bodybuilding times, and you were talking about the food relationship. I mentioned it before. I mean, I'm telling you right now, I had literally a Pinterest of like cheat ideas, cheat food ideas, cheat food, cheat day, and then. I mean, even to the point where it's like I minimized calories to the point where I had no energy throughout the week, and then Saturday I would eat like 10 Oreos. Right. And obviously that's not a good food relationship. Sure. No.